Thank you, Heidi. Well, bands like Smash Mouth face controversy for holding concerts like this. There was no social distancing or anybody wearing mandatory masks. And we've seen artists get creative, hosting virtual events or performances at drive-ins across the country. Well, it's probably safe to say the days of going to a packed concert hall or even stadiums, they're over, at least for now. So when will these types of events be safe to attend without a mask or even being 6 feet apart? Dr. Ernst von Schwarz joins us this morning with what you should consider before attending one of these events. Thank you very much for joining us, Doctor.
Good morning, Javier. Thank you for having me on.
As of right now, is it safe to attend one of these? And what is the threshold when you talk about groups of people?
I don't think it's safe at all. So my recommendation is don't join the mass events. Even though, I mean, the numbers have gone down significantly in LA County, where I'm, for example, there were still 733 new cases yesterday of COVID-19 patients, and 24 patients died, actually one of mine just this morning. So even though numbers are going down significantly, which is a good thing, we are very concerned about what's coming in the fall with the flu season, which lowers our immune system, which opens the doors for additional infections. So if you don't have to go to a mass event, don't go. If for whatever reason you think you need to join an event, then, I mean, we should really keep the social distance measures significantly intact. Prefer outdoors rather than indoors. Keep a distance of 1.5 meters or 6 feet from each other. And of course, wear the protective gear, meaning masks. Even though the CDC doesn't recommend to use those, what we call N95 respirator masks outside the medical professions. I mean, if I would need to go to a crowded event, I definitely would wear that mask rather than the standard masks, because it gives you just more protection.
So are we, like here in the state of Arizona, we've had constant benchmarks where the positivity rate, depending on how low it went, that's when other businesses could open or kids could get back to school. Are we looking at a particular benchmark or some sort of number that will tell us it's safe to go to these crowded events?
In general, yes. I mean, you want to look at the local R factor, which is the reproduction factor or the transfection factor, which should be less than 1. If the R factor is 1, that means one person infects one other. If it's above 1, 1.5, for example, then 10 people will infect 15 others. So we want that below 1. That would indicate that the infection rate goes down and quickly the virus would die out. However, I mean, it's not that easy to calculate those factors. And if you are in a local area, ideally you want to check with your local health authorities, what is the R factor? If it's high, stay away from the crowds.
Yeah, we have been below 1 for the last few weeks, so we're trending in a better direction. Let me ask you real quick while I have you here. The CDC just came out and said dining in restaurants was not a good thing, and they attributed a lot of the spread of COVID to dining in restaurants. Would you agree with their assessment?
I would. I think indoor dining, even though in the area where I'm right now in Orange County in California, it is allowed. I'm a little scared about that. I think outdoors is just safer because there's much better air circulation and less risk really to contract the virus. I'm not quite sure if the restaurants will stay open throughout the fall. I'm very doubtful about that.
And when you talk about big rallies, like we just saw a couple weeks ago, the Sturgis rally, where there were thousands of bikers in a big group, even though they were outside, that's still concerning.
Absolutely. I mean, if you look at the trackers, where do people contract the virus? It's always gatherings. Interestingly enough, it's mainly family gatherings. So a relatively smaller group of 20 people. Even some of my co-workers recently got infected because they went for family gatherings, and one elderly person was sick, and then 5 others out of 15 contracted the virus, and 3 ended up in an intensive care unit on a respirator. So any kind of gathering I would stay away from as much as possible.
Would you say we're going to have a vaccine before we can get back to the big concert events and big events like that?
Yes. I mean, the latest news I heard from different sources was that there might be a vaccine available definitely before the end of this year. But keep in mind, even if we have a vaccine, we don't know as of yet how reliable it will be and whether it will catch everything. Look at the flu vaccine. The last year's flu vaccine covered approximately 40 to 50% of cases, but not 100%. So even if we have a vaccine, we have to wait and see how effective it will be for the general population.
Yeah, then we have to consider mass distribution. So thank you very much. Always great insight, Doctor. Thanks for joining us here on Good Morning Arizona.
Thank you, Javier, for having me.
All right. We'll be right back.